There's a new study that takes a look at the effects of social networks on healthcare. Millions of us use the internet to decode our symptoms, and now millions are turning to Twitter, Facebook, and chat rooms to share information with other patients. But can all that information be trusted? ABC News senior health and medical editor Dr. Richard Besser takes a look.
The study looked at 52,000 tweets over 4 months and found that misinformation spreads fast.
What is it you found on Twitter with regard to antibiotics?
Even one tweet indicating misuse of antibiotics could be spread potentially to hundreds of thousands of people via the Twitter network.
Like this one. Finally over my cold. Summer colds suck. Thank you, Z-Pak Antibiotics. That single tweet reached more than 850,000 people. But it's wrong. Antibiotics will not cure a cold.
Here's another one. Think office flu bug finally hit. Chesty cough, pains. Didn't tell the doctor, but I still have some antibiotics left over from the last time. Really bad idea. Never share antibiotics and never keep antibiotics to use for your next infection.
It's not just Twitter, but social networks like Facebook and MySpace, chat rooms, blogs. Everywhere you search, websites are dishing medical advice. This one says, feeling achy? Try this herb. Problem is, medical evidence doesn't prove that herbs can actually make you less achy.
Go online for health research because it's right there. It's, at the touch of your fingers.
But web surfer, beware. What you read online may not be just what the doctor ordered.
And Dr. Besser joins us now. Hello, Dr. Besser. Great to see you.
Good to be here.
So the study showed that 12% of people who go online also use Facebook and Twitter to get medical information. Is that right?
It is a growing area for people to find information about their symptoms, about diseases they're interested in. It's almost become now a third person in the exam room with you and the doctor. The internet is there.
Well, I'm glad you bring that up, because how do doctors tend to respond when a patient comes into their office and says, look, doctor, I looked it up and this is what it is and this is what I have, and they seem armed with all this information. Are doctors receptive to that?
Well, it depends somewhat on the doctor and the patient, how you approach that information. Mm-hmm. There isn't a lot of time when you're in with a doctor for that encounter, for that visit. And if you're pulling out sheets of paper from the internet and wanting the doctor to review all that information during the visit, it may crowd the relationship a little bit.
Right.
But I find that a patient who comes in who's read, who's a little informed, their questions are going to be more informed than someone who knows nothing at all about their condition.
So this can all be very useful. I guess the key is the source of the information, right?
The source of the information and how you approach it. If you challenge your doctor with that in a way that can be threatening, some doctors aren't going to respond very well. But the source is critical, and there are things you can look for on the web when you're picking your websites, or when you're hearing information from a friend on one of the social networks. Look at the tag on the website itself. If it's edu, it's an educational site. If it's gov, it's a government site. Those can be really good clues to impartial information. org is what's used often for nonprofits like the American Cancer Society, American Heart Association. If it says .com, it's a for-profit site, and you can find good information, but be aware that many of those sites are trying to sell you something.
Right, they may be peddling something on the side with that information.
That's right.
So what about Twitter, though? I mean, we get a lot of information disseminated very quickly on Twitter, and if one tweet is incorrect and gets passed on to thousands of people, it can do a lot of harm.
Does. This study was interesting. When they looked at the information about antibiotics, more than 95% was pretty decent information. But 5% of the tweets were not. And when you look at any one of those tweets, there was one tweet that was really bad information that went out to almost 1 million people. And so it all depends who is following the person who sent that information and whether they retweet it. Because you can forward information you get and it can just expand exponentially. So information that you get that way, you really have to source. You want to go to websites and check it out, and talk to your doctor before you act on any of that information.
So Dr. Besser, is the bottom line here that these networks, the Twitter and Facebook, are they helpful or harmful?
I think they're helpful.
Okay.
When you look at the doctor-patient relationship, many people are intimidated at asking their doctor some basic questions. So you can actually try it out on a site like Twitter and ask people and get some input. My takeaway, though, is don't act on that. Use it as a way of finding out, well, is this a question worth taking to my doctor? Is this a question that makes sense? Is there a better way I can go at this? But it can give you some of that information and maybe confidence to approach your doctor with something that's sensitive.
And what about turning the tables? What if you are the organization trying to get information out to the patients? Is Twitter useful?
I think it is. CDC used Twitter a lot during the pandemic to get information out. When you look at how people get information, it's changing rapidly. There's an audience who just gets information from TV and from print, but there's an audience as well that gets their information through sites like Twitter and Facebook and the web.
And I'm guessing this is the growing younger generation.
It really is. And if you want to hit them with important information, you have to give it to them the way they want it. Another interesting approach is to use a site like Twitter to try and identify health trends. That's been done on sites like Google, where they've been able to track flu across the country by looking at search terms. Most of the information on Twitter, over 95%, is open for searching. So you can imagine ways of looking in there for clues that there may be something going on with the health of your community. And I think for public health, that could be very exciting.
Absolutely. Now, you've given us clues on what to look out for when we go online, what sites can be helpful. Are there any red flags that we should be aware of?
Well, a lot of the sites that I looked at when I was on Twitter were linking to other places, and most of them were trying to sell something. I would be very cautious of any site on Twitter or those kind of places that's trying to sell you something. Don't give any information. Don't give any personal information. Be careful because there are folks out there who are using those sites in a bad way.
Be wary. So bottom line is, in general, this is all a good thing, but be wary.
You have to know your sources.
Research.
You have to be a smart consumer of that information. But I think the more ways you can go at getting information, really the better.
All right, Dr. Vesser, thank you so much for explaining this all to us. And for more health and wellness news, you can always check out the health page at abcnews.com.